Let's talk to Lord Bethall, former Conservative Health Minister. We learned the news yesterday that the BMA, that sort of Marxist organisation pretending to be a doctors' association, but is really a trade union, has voted once again to go out on strike. So doctors will once again cripple the NHS. Wes Streeting says the public will never forgive them. Lord Bethall, very good morning to you.
Mike, I feel like I will never forgive them as well. It is absolutely heartbreaking what's happened.
Yeah, and it is ridiculous given what happened last year. You know, the Labour Party got in, they said we're going to sort out the health crisis once and for all, we're going to pay the junior doctors the money they want. They gave them 22%, and everybody, including me, said, you know what's going to happen here, they're going to come back for more in the new year, and sure enough, you know, they waited till July, but they're coming back for more. 29% they want now.
I know, it's so frustrating. Everyone warned the Department for Health that this was going to happen. There was a big appeal that this pay rise should be linked to performance and to changes in working arrangements. Yeah. My goodness, the NHS needs that. It needs productivity gains and modernisation. They went in with lots of goodwill to try and settle this dispute. I kind of understand the pressure. But now the doctors have come back for more. Don't they realise that there just isn't any more money?
Yeah. Right, and I mean, even if there is more money, which you know, it's been dropped already into the sort of the black hole that is the NHS. I mean, I think it was in the spring statement, wasn't it, that Rachel Reeves said she's going to drop another 30 billion into the NHS, which even the NHS said won't even make any difference. It won't touch the sides because it's just a massive black hole where everything just disappears.
Well, I wouldn't quite put it like that. There's 30 billion is going in to try to use things like technology to improve productivity and to catch up.
Yeah, but look at the number, though,
waiting
Jim.
list.
The number is huge. 30 billion. I mean, I'm all for technology improvements, but 30 billion?
Yeah, and other departments have made huge sacrifices. You know, tell that to the school secretary or to DEFRA or some of the hard-hit departments. You're right. The whole government has made a massive sacrifice to put a large amount of money into health. I happen to think that some of that could make a difference, but it won't if the doctors go on strike. That'll just blow everything up again.
Yeah. Well, that's right. You know, because Keir Starmer keeps banging on, and it's one of my big bugbears on this show. He keeps banging on about all the extra appointments that are being made. You know, he said that we were going to get 2 million, then it was 3 million. Now he's claiming they've got 4 million extra appointments, and everybody I talk to tells me that for every procedure that they get eventually done, they've had about 4 different appointments made. So I'm beginning to wonder whether there's just a series of sort of appointments being made, but not actually honoured.
Well, you're right that it is incredibly inefficient internally, and these stories of patients being bounced from one thing to another and they're going in and having their... Someone told me yesterday that they went in and had their height measured 4 times in the same afternoon for the same procedure. I mean, that does give you the impression that the management of the NHS is really struggling. But listen, there are some good things going on. There are some uses of technology. The app is a lot better. Lots of people do have procedures that go very smoothly. It's not all bad. But this strike, I promise you, it's going to cost a lot of lives, and it will throw all of those improvements backwards. It really will.
And is there an opportunity here, perhaps? I know the Labour government won't do it, but to look at the BMA, because I'm told, you know, quite a lot of doctors are not actually in the BMA, so they won't go on strike. And less than half of those who are in the BMA actually voted to strike.
I know. I find this a weird aspect of the whole thing. You speak to a lot of doctors and they'll say, oh, it's just the BMA, it's nothing to do with me.
Yeah.
But hold on a second, it is your union.
Right.
So where are the grown-ups in all of this? If a lot of doctors, if half of doctors don't really think the BMA is representing them, why aren't they out there voting? How did 45% of doctors not vote? I can tell you, if it was my union and they were going to do something that I didn't agree with, I would be out there voting and having my voice heard. Very difficult to hear doctor criticise the BMA.
Yeah.
I understand that. They are a vicious organisation. They've come after me on a couple of things and it hasn't been pleasant. Right. But that doesn't mean that doctors who are paid a lot of money and should be grown-ups can't challenge their own union.
Yeah. And so, I mean, what is Wes Treason going to do here? Because he can't give them any money, but he equally can't allow them to go on strike. You know, somewhere in the middle is going to have to be some resolution, right?
Well, on one level, he has my sympathy. This is a real problem because the BMA does have his hand in a vice. On the other, I don't know what his plan is. And this seems to be the repeated story again and again with this government. They had a long time. They were very, very critical of the way that the Conservatives went about handling the BMA. It was not helpful for the opposition to be criticising the government month after month after month as former secretaries of health tried to wrestle with the BMA. A little bit of support from the opposition would have gone a long way. And so how did they game plan this exactly? What exactly are their moves? I haven't seen an agenda for change. I haven't seen some kind of proposition from DHSC that puts, for instance, performance and workplace changes on the table and makes a case to the public and to doctors for some kind of reform. It's all still very narrowly about pay, pay, pay. And that's no way to conduct a modern negotiation.
And they always contend, of course, it's not about pay, it's about conditions, but we all know what it's about because otherwise they wouldn't have taken the 22% pay rise. Mick Wellington says this: the BMA should be a prescribed organisation due to the willful damage caused to the population. I mean, I think that's just going to be the way every government now goes. Just go, let's prescribe them, make them a terrorist organisation, and then they won't be able to operate.
Yeah, I don't think that's
not quite there.
But I don't agree with you completely. Being a doctor at the moment is really tough. A lot of them have found that they're in jobs that they didn't really think that they had signed up for. A lot of the conditions are tricky because the NHS isn't well managed. It's very hierarchical. They feel that they're pushed around a lot. You can't book your wedding because if it doesn't fit in with your rota, it might get cancelled. There are these quite nasty, egregious work conditions that makes being a doctor right now really miserable. But what I don't understand is, why isn't that on the table? Why isn't Wes out there making the case for a modernisation of conditions? And that, I think, is what a lot of that's what motivates a lot of doctors. I don't think it is just pay. Of course, the BMA, that's all they bang on about because they're trying to show value for money for the fees they charge to doctors. But actually, in their hearts, what most doctors want to see is their own profession being modernised and for their fulfilment to be improved.
Yes, indeed. Lord Jim Bethall, thank you very much indeed. Former Conservative Health Minister there talking to us about the junior doctors' strike.